award, and what do you think has led to this recognition?
It's a real honor to be a part of this list, which has very many illustrious names. So I'm really very humbled with this recognition, and I thank Business World for this. I have been working in the public health field for several years. It is a field I'm very passionate about, and it is a field that directly touches the lives of people. So my attempt has been to try and make a small difference to people's lives. And most recently, I've been working in the government's premier policy think tank, Niti, Aayog, where I've been working on a number of health policy related issues. And I think it is a recognition of some of that work.
And when we talk about policies and when we talk about the government's initiative towards improving the healthcare scenario of India, what are the challenges that the government is, looking from its lens at this point in time, and what are the new policies that it's working for?
Yeah, so healthcare, is a very complicated sector, and there are many challenges for the government to address. But over the last few years, the government has brought in a number of reforms, a number of programs, whether it's Ayushman Bharat, whether it's Poshan Abhiyan, whether it's the medical education reforms, or whether it's the COVID vaccination program. There is a lot that has been happening in the sector and in the country. We still have a lot of challenges to address. Especially we have to make sure that we focus on public and preventive health as opposed to curative healthcare. We need to promote wellness. We need to keep as much of our population outside hospitals as possible. So that is really the big challenge that the government is working on, and is focusing a lot of its programs on public health and prevention and wellness.
Right. How do you view the next 2-3 years or 5 years of the healthcare industry in India?
I think we are going through a post-COVID phase, so we are certainly going to see a very rapid acceleration in the adoption of technology. I think technology is going to be a game changer for the health sector. We are also going to see a lot of innovation in pharma, medical devices. We need new drugs, we need new vaccines. Antimicrobial resistance is becoming a big challenge for the world. We have to reach our TB eradication target that the Honorable Prime Minister has set for us. So I think we have a lot of challenges and a lot of work to do, but the government is certainly ready to take on these challenges, and will be building on the programs and the reforms that have been undertaken over the last few years.
Thank you so much for joining us.
Thank you.